My name is Suzanne Cafferky and I'm here with my colleague Hannah O'Connell, and we are both registered acupuncturists of the Acupuncture Council of Ireland, and we're here to discuss the benefits of having acupuncture before and during IVF procedures. The ideal time to attend an acupuncturist is preferably 3 to 6 months before embarking on any treatment. This may seem like a long time, however, if you look at the ovary itself, there's a process called folliculogenesis where the actual eggs start on their journey, and this can take up to 150 days for the egg in a normal ovulation process to actually be released. IVF is actually going, in most cases, drug-induced IVF is actually working to actually get as many eggs as possible. So acupuncture is proven to actually help improve the quality of the egg and the sperm, so the man can actually attend an acupuncturist as well, where it helps to improve the endometrial receptivity. It helps to reduce the side effects of the drugs. It's also been proven to help reduce the anxiety levels of the woman or even the man while they're actually undergoing the treatment.
Yes, absolutely, yeah. There are various side effects of abdominal pain. The drugs themselves, will give a lot of side effects. I would, in my own clinic, a lot of the time treat anxiety and stress. It's a stressful time. Trying to create a baby through IVF is very stressful. It's stressful on both partners. So I would often treat both the man and the woman. So you're looking at sleepless nights, bad dreams, physical tension, because the whole process is very stressful. So acupuncture is fantastic in supporting what's going on and treating the person to alleviate all of those symptoms.
But it's also great at reducing the side effects of the drugs. So, for example, people who are actually undergoing downregulation often suffer with headaches, and we can actually help with that. And the great thing to actually realise is that it's not altering what the actual drug is trying to do in the body. So, for example, when they're actually going through the stimulating process, women can also complain of bloatedness, pain. They can also complain about having night sweats, for example. And again, the acupuncture can definitely ease, if not resolve, these problems. And again, it's supporting the treatment that they are undergoing, and again, helping to improve a better outcome. That really depends on what type of procedure the woman's having. So some people might have 4 weeks, some people might end up being extended out due to possible cysts. Some people might end up having the flare protocol, which is just under 2 weeks. So my advice would be to turn around and say that usually during downregulation they come once a week unless you feel that they need a little bit of extra support. And while they're actually being stimulated, in my practice anyway, would work with the woman every 2 to 3 days, but I work alongside actually what's happening with the scans and their blood tests at the clinic at the time. The advice and the protocols that I have been following, and I think most of us are following, is known also as the German protocol, where it's advised to actually have acupuncture directly before you actually going to have your transfer and afterwards. And in some cases, this is not. It isn't possible because there isn't an acupuncturist on board in some of the clinics. So I tell people to come to me just before they actually go to the clinic. Why do we advise this? First of all, the feedback is it's easier to transfer the actual embryo. What's interesting is that people who've had failed IVF attempts and had difficulties in transfer when they've had acupuncture, the actual medics actually noted this was much easier. transfer, and secondly, it helps to reduce uterine contractions, therefore, helping for the embryo to hopefully embed and for a pregnancy outcome to occur. Yes.
Yes, acupuncture is looking specifically at the reproductive system, the uterus, basically making a happy home for a child. So you're looking at circulation, not only so in the actual positive pregnancy, but also going forward too, that it stays that way, that the child is healthy, that it goes to full term. There are lots of reasons for things like miscarriage, so acupuncture is supporting that problem doesn't arise.
Well, it's supporting the energetics of the person who's in front of you. So, what's really interesting is when people have failed IVF treatments, and then they have acupuncture and then it helps. Why is that? It's because we're not looking at things from a physiological point of view. We're looking at the person, we're looking at their overall health, we're looking at the overall menstrual cycle, we're looking at the mental, emotional, and even deeper levels, and supporting the woman through that time. But if you want to put it into physiological processes, we help with regulating menstrual cycle, we help with all the sort of pathologies that shouldn't be there. And bottom line, help the woman to be stronger. There are some suggestions that it helps to improve the egg quality, increase the endometrial lining, which is incredibly important, but also to help fully balance the hormones. Therefore, the luteal phase or the progesterone phase in the body is actually high enough to help to support the pregnancy.